Um, all right, here we go. We are going to get started, and our mayor is going to be joining us shortly. We apologize for the delay. We had a little bit of audio, but we are trying to navigate through this tough time of doing virtual town hall. So first, I do want to just thank you all for joining us this evening. And this is actually our second all-city town hall. And my name is Leslie Arroyo, and I am the communications director for the city of South San Francisco. And I will be the moderator for tonight's town hall. I wanted to describe how this town hall will go. First of all the lines are muted, and that's just simply because of the technology, and for such a large phone call to occur, it's obviously hard to make it a productive call when lines are live. So we have received a lot of questions about this town hall ahead of time, and we will get to those specific questions in just a bit. If you have a question tonight, there are 3 ways that you can send us a question. First, you can email cityinfo@sssf.net. That's cityinfo@sssf.net during this call, and we will address it. You could also send a text to 650-636-6668. And for those of you happening to be joining this call on your computer, there is a chat function, and you can submit a question that way, and we will address it as well. Now, if after this call, a question does come up, please don't hesitate to email us. And again, as I mentioned, that email is cityinfo@sssf.net, and we will respond to your email. And then again, all the questions from tonight, as well as this audio of the town hall, will be posted on our website. So we'll have the town hall audio, and we'll have a FAQ section, and you can find that at our website, sssf.net/coronavirus. Or if you just go to sssf.net, you'll see a big landing page that will guide you to our coronavirus resources page. So tonight's town hall, we are hoping to get our mayor online with the audio, and it's going to feature our mayor, Rich Garbarino. And also on our town hall, we have our police chief, Jeff Azzopardi, our fire chief, Jess Magianis, and then in addition to that, we have our city manager, Mike Futrell, who will give us an update from the last time we had the town hall regarding the coronavirus. And then lastly, we do have Dr. Brian Sloan, who is a doctor with Stanford and is also with the San Mateo County Emergency Medical Services, and he will speak about what's going on from the county side of things, as well as answer health-free related questions. We will, as soon as we get the mayor on the line here, we will have him join us to say a few words, but in lieu of that, what I wanted to do is first have our police chief just say a few words about the shelter in place. Jeff, are you on the line?
Yes, I am. Can you hear me okay?
Yes, I do.
Okay. So good evening, everybody. Once again, my name is Jeff Azzopardi, and I'm your police chief. And I just want to start off by thanking everyone. The support that our city and our first responders have received from our residents has been fantastic, and I just want to thank you all very much. I also want to thank everyone because the vast majority are doing exactly what we ask, and that is to follow the orders, stay at home, and be safe. And what we're finding is yes, we are getting some calls about some of the people that are maybe not following the orders. Sometimes it's people that just don't know exactly or understand the orders, and sometimes it's just people that simply don't want to follow the rules. And we know how hard it is right now, but we're trying to continue to use education as our means of enforcement. So what we'll do as often as we can is talk to whoever is maybe not following the orders, let them know why they're there, provide a mask if they need one, if they don't have one, and basically just try to educate them on being safe, following the order, and staying at home. And generally, we're finding that the residents of South San Francisco are doing a great job in that. So we're just asking everyone to please stay patient, stay patient with us as we're all trying to work through this together. And thank you again for your support, and please continue to follow the shelter-in-place orders that we have currently here in San Mateo County. Thank you very much.
Great. Thanks so much, Chief, for joining us, and we appreciate that update. And now I'm going to turn it over to our fire chief, Jess Magianis. Jess, can you hear me?
I can. Can you hear me?
Yes, I can. Thank you.
Okay. Well, I wanted to echo the police chief's comments, and well, I should start by saying hello, everybody. I'm Jess Magallanes, your fire chief, and yes, I wanted to echo the police chief's comments in that I really want to thank everybody for all the support that they've shown the public safety agencies here in town and throughout the county, and all the consideration that you've given us. I also want to thank you for following the county health officer's directive of sheltering in place. Initially, as a fire department, we were concerned that our EMS system and our hospitals would be overrun by the number of sick calls that we would have, and the hard work and sacrifices that everybody has made has not brought that to fruition, and that's been, we're very grateful for the fact that that has not happened. So I did want to also give everybody a little bit of an update on the department and kind of some of the things that we're doing to make sure that we keep ourselves safe and keep the community safe. So overall call volume for us has gone down a little bit, but our EMS calls have gone up, which makes sense with the illness. Fortunately, we do have an adequate stock of PPE, and we have more than enough to sustain us for more than a month. All of our equipment is available. All 3 of our ambulances are in service every day, and we do have the ability to increase up to 5 ambulances if needed. Internally, we're all practicing social distancing. We're making sure to use our face coverings both in the stations and outside of the stations. We're disinfecting all of our equipment and our apparatus in the mornings and then after every medical call. And we're making sure to disinfect our stations in the morning and then before we do any food preparation as well. One item I did want to bring to everyone's attention is the fact that because of the shortage of gowns and as PPE, our department has transitioned to using coveralls, and we're renting the coveralls, so they're not our regular uniform. And I did want to let everybody know that if you do call 911 and it's for a medical call, or if you see us on a 911 call and it's medical in nature, that we'll probably be wearing these coveralls because they're easier for us to clean and change without getting contaminated. So for the short time being, we're going to look a little bit different, but we are going to be wearing our department IDs around our neck so that you would know that it is the fire department, plus we'll have our equipment. And but if you don't see us near the engines, just be aware that we look a little bit different on medical calls. I know that this pandemic is different than anything that we've seen in the past, and but I want you to feel comfortable with the understanding that these are the type of events that the fire department and the city in general practice to be able to respond to. And your fire department is here and ready to respond and serve our community. And thank you again for everything that you're doing to assist us to assist you.
Oh my God.
Hello?
Well, this is Mike Futrell, your city manager. Maybe we have lost Leslie Arroyo, our communications director. Jess, can you hear me okay?
I can hear you, Mike.
Great.
You can.
There's
Thanks, Mike.
Leslie.
Actually, you can hear me now. There I am. I'm back. Thank you. We're going to turn it over to you. Thank you for introducing yourself. I meant to introduce
Okay.
you, but we do have our city manager, and Mike is going to kind of give us an update on what's going on since the last time we had this town hall and city updates. Thanks, Mike.
Thank you, and welcome all to the joy of operating virtually in these new environments. We will get this down, I promise. On behalf of myself, Mayor Rich Garbarino, who's still trying to tackle the technology tonight, as well as the entire city council. Let me thank our police and fire department who are still on the front lines. They are not at home as many of us are. They're keeping us safe, as well as our public works department, which is on the job, making sure our sewer system works and our traffic lights still operate and our streets are still functioning. You have a lot of public servants who are dedicated to South San Francisco, so we thank you. Also, a shout out and a thank you to our healthcare providers at Kaiser Hospital, South San Francisco. We speak to them regularly. We work with them all the time. They have a steady stream and are working hard, and we thank them for the work that they are doing for us. As for the rest of us, residents of South San Francisco, we are in a shelter-in-place order, which remains through the end of the day on May the 3rd. But I will tell you, my best estimate is that will be extended. So whether it's extended to May 15th or May 30th, that is being decided at the county level. In the 9 counties in the Bay Area, all the health officers are working together to decide when is the time to lift the shelter in place. I think it's pretty clear that it will be extended beyond May the 3rd. Many states in the United States have already done that, and you can expect it to go on a little longer. And even then, it will be lifted in phases. They may say we can go back to work, but we can't have groups of more than 10 or 20 people, and we all have to wear a mask and must maintain social distancing. Even though the shelter in place may technically lift, we will be under certain health restrictions we'll have to abide by for our own safety. Until there's a vaccine for this particular novel coronavirus, I think the new normal as we move forward. Part of that are new business protocols. I think you know that some businesses are open and some businesses are not. Those essential businesses are required under the new shelter-in-place order to post social distancing protocol, to actually develop a written protocol on what they do and then post it for the rest of us to see at the entrance of the business. And you may have heard, at least I hope so, that effective Monday, we must all wear face masks in public. So if you're going to the grocery store or to work or to the gas station, you must wear a face mask. They can be anything, a shirt, they can be a cloth mask that you make yourself. They can be the simple paper mask you see a lot of people wearing. The only ask and requirement is that they not be the hospital grade N95 masks that are in such short supply and that we provide to our first responders. For example, every police officer and firefighter in South San Francisco has an N95 mask available if they respond to a call and there's some risk of being exposed to the coronavirus. But otherwise, bandanas, scarves, anything. But if you're out in public, wear a mask. That is required, and that will be enforced. As our police chief has said, we are in the education business when it comes to enforcement. So we will not be arresting you and carrying you away, but we will stop you and say you must wear a mask. And you may have already noticed many of our essential businesses will not allow you to enter the business unless you're wearing a mask. So for your protection and the protection of people around you, please always have a mask handy, wear a mask. And I think you can expect we'll be under this particular order for several months of wearing a mask. So the order does not require you to wear a mask when driving alone or with members of your family. And it is recommended but not required if you're outside running or bicycling. But social distancing is also still required. A few things that our city council has done, as well as county government, to protect our people, because these are unprecedented times. One, we have a moratorium against residential evictions. Many people have lost their jobs. In the United States, over 26 million people have applied for unemployment. We haven't seen this type of unemployment since the Great Depression in the 30s. So this is a catastrophic event, and there is a moratorium for the next few months on evictions if you cannot pay your rent. So there are specific rules about that. If that's an issue for you, I urge you, go to our website, ssf.net, again, ssf.net, We have a whole site for the coronavirus. We have resources for businesses, resources for residents. If you're having trouble with your rent, go there, see the rules, talk with your landlord. Help is available. In that same sense, we are providing food for those in need. The mayor is going to update you on that when we get him on the line. On the business side, we've done the same. The city council 2 weeks ago passed a moratorium on small business evictions. Many of our small businesses are closed. They have no revenue, and we are trying to protect them until such time as they can reopen. So there is a moratorium that our city council put in place on commercial evictions. So we are trying to help as well. There's also money being made available for small business. One, the federal government, and today the Congress passed additional funding for business relief. But just last night, the South San Francisco City Council put a plan in place to provide nearly $500,000 for local businesses in South San Francisco to provide bridge loans and grants so they can stay in business until they work with the Small Business Administration to try to get greater relief. And then eventually we will open back up and hopefully our economy will recover. But it's important to this city council and to your city staff that we protect our residents, that they not lose their homes, that they have the resources they need, and that our small businesses survive as well. And hopefully we can get back to that way of life we love in South San Francisco. There's also, if there are small business owners on the line associated, it's a county fund that will open on Monday. On Monday, April 27th, San Mateo County Strong will make available grants for small businesses in San Mateo County. Their website is smcstrong.org, smcstrong.org. There's really extraordinary efforts being made to help individuals, residents, and businesses so that we all come through the other side of this okay. So stick with us. South San Francisco is a strong city. It is financially strong. We have a resilient population. We are the industrial city with a legacy of coming through tough times, and no doubt we will come through this as well. I will take one moment on something a little off topic, and that is the census. Oddly, we are trying to do the census in the middle of all of this, but the deadline to respond and submit your information for the census has been extended to August the 14th. So those on the line, if you have not yet registered for the census, please go to my2020census.gov. That's my2020census.gov, or just Google Census 2020. It will come up. And register. It takes less than 5 minutes, and it's super important for your city. Much of the federal and state money is allocated on population. And if we have a full count of our population, then there will be more funds to pay our police officers, to renovate our parks, to upgrade our streets. And it's important that we get a full count. I think all of us would agree our population has increased recently. We need to get a full measure of that. So my2020census.gov. And one more time, our website, ssf.net. We provide a ton of information there. We also push out 2 weekly newsletters, e-newsletters. You can sign up there to keep yourself up to date. And I think we've done, and Leslie, who is our moderator, has done a pretty good job of keeping residents informed with mailers and otherwise, because this is a fast-moving situation. And we want you to get all the information necessary for you and your family to try to navigate this successfully, because we all are in this together. So, Leslie, I'm going to turn it back over to you. I know we've got Dr. Sloan, who is our version of Dr. Fauci, to give us some more information.
We do. Thanks, Mike. And I'll tell you what, we are going to try to get our mayor. I've received word that we might have him Mayor Rich Garbarino. He's been listening and he's been with us this whole time, but just unable to get him unmuted there. Rich, are you able to talk to us? Okay, well, I thought we had him, but at this point, we're going to turn it over to Dr. Sloan. Dr.
Hey,
Sloan,
so we have to put you on the phone. Let me see if that works. Hold on, Leslie. Let me see if I can make this work. You ready, Rich?
Okay.
All right, let's see how this goes. All right. Thanks, everyone. This is your mayor, Rich Garbarino.
Yeah, hello, can you hear me?
Yes, we can. Thank you, Rich.
Hello, can you hear me?
Yes, we can.
Okay, 1 second here. Let me get to where I need to go. Hold on. I'll be right. Okay, sorry for the technical difficulties here. It's I've been trying for 45 minutes to get through and haven't been able to do that. So I believe I'm live and on ready to go here.
Yes.
Okay, so thank you much. Thank you everybody very much. This is Mayor Rich Garbarino, and thank you for joining us this evening for another virtual city town hall. It's hard to believe that we're moving into week 6 of our shelter-in-place order, and I know for all of us, this has been an extremely difficult time. Know that we are all in this together, and we are going to do everything we can to assist our residents and our businesses during these stressful times. In fact, tomorrow from 10 a.m. to noon, the city, in collaboration with Second Harvest Food Bank of Silicon Valley and Hope Ministries, is hosting a drive-through emergency relief food distribution event at the Montessori School, which is the former site of Hillside Elementary School at 1400 Hillside Boulevard here in South San Francisco. Excuse me. The event is free and open to the public, where 750 food boxes will be distributed. Each household will receive one substantial food box, which contains fresh produce, dry shelf-stable items, dairy, and protein, a 2-week supply of nutritious food. There are no requirements for this, and no one will be turned away. The city is taking action to support our community's essential and most basic needs during these unprecedented times. We plan to host these food distribution events on the 2nd and 4th Fridays until the end of June 2020. Again, that's on the 2nd and 4th Fridays until the end of June 2020. One last item I wanted to address is the generosity of our local businesses and local individuals. The city has received countless emails of residents wanting to lend a hand, whether it's volunteering for the South San Francisco Community Volunteer Corps, or it's donating to the San Mateo County Strong Fund, which is a fund set up to help San Mateo County organizations in need. There are many stories to share, but one example is here from South San Francisco, See's Candy. Despite shutting down its operations for the time being, they did recently donated 1,800 boxes of chocolate truffles to self-help for the elderly's Meals on Wheels program that serves 800 seniors each day. You can imagine the surprise and delight of these recipients. In addition, See's donated 150 boxes to the YMCA Community Resource Center for their April food distribution events. That's not to mention the donation they did a few weeks back to our emergency responders in the county's Emergency Operations Center and our South San Francisco Fire and Police Departments, as well as our public works crews. It's times like these where you see the true character of our community, and I'm proud to be a resident and mayor of South San Francisco. Thank you again for joining us tonight. Leslie?
Okay, Rich. Well, thank you for joining us, and we have, again, apologize for the audio difficulties, but we're able to have, glad that we're able to have our mayor on the phone. I'm going to now turn it over to Dr. Brian Sloan, and he's going to give us a little bit of update from the county side. Dr. Sloan, are you on the line?
Yes, ma'am. Are you able to hear me?
I sure can. All right, go for it.
Fantastic. So, I do want to start off by saying thank you very much for having me today. It's an honor to be a part of this virtual town hall. I do first want to start off by saying that some of the recommendations and some of the things we're going to talk about today are definitely different than some of the recommendations and things we talked about at the last town hall meeting. I expect that to continue to be the case going forward as well. We have learned an incredible amount about this virus over the last several months, and especially over the last several weeks. And as we learn more and more, the recommendations and the state of where we're at is going to continue to change. So the things that we talk about today very well may change not only by the time we have the next meeting, but even by the time tomorrow rolls around. We're at an unprecedented rate of new discovery about this virus, which is giving me a lot of hope. Discoveries and new tests and therapeutics that would have taken decades to be developed are happening over the span of days. And we have the force of essentially all of the scientific might, not only of our local area, our local universities, and the rest of the state, but the entire country and the entire world are all working together against this common foe. And I think that effort is really being demonstrated, and we're moving forward by leaps and bounds compared to where we were even just weeks ago. With that being said, I do want to go ahead and jump into the numbers, which I'm sure everyone's been waiting for, about where our current infections are. I think last time we talked, there was a lot of anticipation and a lot of concern about where we would be at this point, and some models had showed that by this point of the infection, we might have already been out of hospital beds and ICU beds. Fortunately, we have done a spectacular job in this county and in the state at flattening the curve and increasing our hospital capacity and making sure that we're able to handle the needs of the community. Currently, in San Mateo County, we have 966 confirmed cases, of which there are 39 deaths. Of those 39 deaths, the majority of them are over age 90, and the majority of them are also male. As of today, 67 patients with COVID-19 are currently hospitalized, and of those 67, 21 of them are in the ICU. I also have some statistics of our neighboring county, Santa Clara County. They currently have 1,987 cases with 95 deaths. Currently, 191 of them are in the hospital, with 72 of them in the ICU. There has also been a major development that was determined this week out of Santa Clara County, which is that the first death related to COVID-19 in this country likely occurred in Santa Clara County and likely occurred on February 6th, which was earlier than we had anticipated. And as we discover more and more about the virus, we do anticipate to discover more and more of its behavior as well as its impact on our community. California-wide, we have 35,396 cases, as well as 1,354 deaths as of today. And nationwide, we have 887,000 cases with over 50,000 deaths. Unfortunately, that does make COVID-19 the leading cause of death in the United States at this time. We have some other specific information, essentially of New York City in particular, and while New York City is not our population, it is the area which we understand the most about the behavior of the virus as well as its mortality and morbidity. There have been over 140,000 cases in New York City, of which 36,000, almost 37,000 have required hospitalization, and 10,290 confirmed deaths, with another 5,121 suspected. That means that so far, of all New York City residents, 0.43% have required hospitalization for treatment of COVID-19, and then 0.1125% have died. And while these numbers do sound low as percentages, those numbers are still exceptionally high in terms of the overall burden of disease for similar illnesses in a population like that, and are especially high considering we do suspect that not the entire population has been affected. So we're still dealing with a very, very dangerous virus, and while we've done an amazing job flattening the curve here and our social distancing has paid off in leaps and bounds, we're still not out of the woods, and we do expect that we may have a resurgence in the future, and that this upcoming fall, as well as the upcoming flu season through the winter, we could see a major resurgence in viral cases. So we are going to be approaching a new normal. What that new normal is still to be determined. I can let you know that the county has been doing a tireless effort making sure that we have PPE, working with hospitals to make sure they have resources, and working with the hospitals to build the surge capacity so that if we do find ourselves in a situation like New York City, we're able to rise to the challenge and meet it. Additionally, we've been working with the fantastic EMS services in South San Francisco. They've been doing a great job finding solutions to the problems that are being faced by everybody. They've found unique solutions to circumstances, especially early on in the pandemic where there were a lot more questions than answers. and I'm in regular contact with the department's EMS battalion chief, Rich Walls, who's been an exceptional leader, has done a great job making sure that the department is able to meet the needs of the community. There are a couple new orders, and I think we'll discuss them a little bit more during the questions. The most notable one is that there is a new health officer order about wearing a face covering in public. And I want to be very clear that this order is not made for protecting you as much as it's made for protecting people around you, because we do know that the virus is spread very easily by asymptomatic carriers and people who don't yet know that they're sick. And wearing a face covering can reduce the amount of virus that someone who's sick is inadvertently spreading around them. And we can talk a little bit more about the specifics, and I think we have some planned questions, but this is very, very, very important because you're protecting not only yourself and reducing the amount of virus that you could get exposed to, but more importantly, reducing the amount of virus that you're exposing to the person walking past you, the person who may be high risk, who may have underlying medical conditions, and that small exposure to them could have very detrimental effects. And with that, I think most of our other announcements are will be addressed in the question and answer topics. So if you have any questions, please use the chat function, and I'm more than happy to answer them.
Okay, great. Thank you, Dr. Sloan. We really appreciate that information. Okay, what we're going to do now is we did receive some questions ahead of time. And again, if you do have a question, as Dr. Sloan mentioned, you can use the chat feature on your computer, or you can text to 650-636-6668, or you can email at cityinfo@ssf.net. So cityinfo@ssf.net. But what I'm going to do is start out with the questions we did receive, and this may address some of the questions you all have on the phone. So first and foremost, people have asked, and I'm going to turn this over to our city manager, Mike, how can I get tested? They're wondering about that.
Sure. Well, first, I'm on our email, cityinfo.net and cityinfo@ssf.net. And there are questions coming in. So thank you for that. We will get to those. But how can you get tested? Well, interestingly, Verily, which is a South San Francisco-based biotech company, was the very first company in the country to do mobile testing. And they have set up a facility that's been very successful. It's set up at the San Mateo County Fairgrounds in the city of San Mateo, just a few miles south of South San Francisco, and you can get tested there. And you go online, their website where you sign up to get tested is projectbaseline.com. Again, projectbaseline, all one word, .com. Fill out a questionnaire, and you can do the drive-through testing there. That's the easiest way, and I'm very proud that is a South San Francisco company getting that done.
Okay, great. Thanks, Mike. Another question in the same vein that I'll have you answer is, somebody did say, I have an appointment to get tested, but I don't have any transportation. Is there any service that can help me?
Yes, absolutely. Because that issue has come up and we're trying to serve everyone. The county of San Mateo, the county of San Mateo has the lead here. They are the health officials for the entire county, but they have reconfigured vehicles that protect both the patient and the driver. And if you need a ride to a testing site, they have a phone number, and I'm going to tell the phone number, 650-779-9375. Again, 650-779-9375. And they can arrange transportation and a special vehicle which has been outfitted to protect you and the driver from any contact and get you to a testing site.
Okay, perfect. I'm going to keep you on the line, Mike, and ask you another question about testing, and it's, when is the city of South San Francisco going to implement general testing for all of its residents? This is for peace of mind and knowing that I'm able to join the workforce and can go see and be with family again.
Sure, a great question, one that's had a lot of discussion at the county level several times a week and frankly daily. We are on the phone with county health officers, with the county manager, as they are managing this pandemic on this very issue. And I am aware that UCSF has conducted testing in the Mission District with the help of the Chan Zuckerberg Foundation. So we are working with the county, but there is not yet an initiative to do community-wide testing of those who are not symptomatic to see if they are able to go back to work. First, it would be a lot broader than just South San Francisco. We're a very dense urban area. We'd also have to test Brisbane and San Bruno to make sure we have area immunity. But for the individual that is not yet in place, I would again try the Verily if you'd like to get it done yourself. But I would like to bring in Dr. Sloan for a little help here, because this is one, it's the domain of the physicians and the healthcare providers on whether we should get this done and how to get this done. Dr. Sloan, what do you think about South San Francisco implementing general testing for all of its residents?
I think that's a very good question. And if you ask any physician who's involved in responding to this pandemic, I think across the board, we do all think that community-based testing and widespread testing is a major part of having a return to normal. But with that major testing, we have to do it in a smart and thoughtful way where we get information that we know what it means and what we can do to act on it. So right now, there's still limitations with the tests, and we've done an amazing job of making new tests that work in new ways. But we don't yet know necessarily what the significance of these tests are in terms of using them to clear the community to go back to work. For example, I can do a great job with one of the tests to find out if you have an active infection. Another test might be good at telling me if you've developed antibodies. But I can't necessarily do both of those tests on a broad-based community level and understand whether or not that means that we can clear people to go back to work. We don't yet know enough about the virus and its behavior to really make educated decisions on that at this time. But we are working on it. There are initiatives in place, many other places where they're doing focused, large-scale testing of the community. While it's not yet at the point where they can test every person, they are looking at the understanding the overall amount of people who are infected and the overall amount of people who have antibodies so that it can help guide us what to do with that information. And while we will probably soon hit the capacity point where we can start doing more testing, we want to make sure that we do the right thing with that information we're gathering, because at this point, we just don't know the significance of those results.
Okay, thank you, Dr. Sloan. That makes a lot of sense. I think we are waiting for the science to catch up where we can do that broad-based community testing so we can go back to the real normal that we all enjoyed 6 months ago. But in the meantime, let's do what we know is appropriate. Wear our mask, maintain social distancing. If you feel sick, stay home. I do believe that the shelter in place will allow us to go back to work sometime in late May. And it's, we'll do the best we can with the precautions that have been provided. So thank you, Dr. Sloan. And back to you, Leslie.
Okay, thank you. We've got a couple different questions on face masks, and I'm going to have Mike, you take this first one, and this is something you've already addressed, but it's worth repeating. And they just asked, is SSF considering an order to require face coverings in all grocery stores and other public places?
Sure. Well, the county has issued that order, and that order is effective in all cities, including South San Francisco. It was effective on Monday. That they began enforcing it on Wednesday. But everyone who is out in public must wear a mask, and people who are in their places of business, if they're restaurant workers or they're working in a grocery store, should be wearing a mask. So if you feel comfortable, you can remind them, hey, you should be wearing a mask. Otherwise, call our police non-emergency line, and we're in the business of politely reminding people that there are orders in place and you should be wearing a mask. We're trying to take, as our police chief said earlier, the soft approach to this. And most people, by and large, almost without exception, do take that to heart and abide by those orders. So as I drive down the street just today, I see people without a mask. Sometimes I feel comfortable, sometimes I don't, saying you should be wearing a mask. But if you don't feel comfortable, call the non-emergency line. I'm going to ask our police chief to come on in a moment and give us that phone number, and we'll have somebody swing by and take care of it. Back to you, Leslie.
Okay, great. Thank you, Mike. Okay, and as I mentioned on the face mask, Dr. Sloan, we have some questions for you. First is regarding homemade face masks. How often should they be washed?
So that's a good question, and you know, as this is a new part of life that we're all discovering, the recommendations are a bit delayed, so we don't have definitive information yet. The CDC does recommend that the face masks are washed regularly, and the overall recommendation is that washing a face mask after a day of use is generally a good idea. Now, if the face mask is at all visibly soiled or heavily saturated with liquid or perspiration, it's much more important to wash it sooner. But it seems at this time that in general, washing your mask after a day of use would be both safe and prudent. Personally, I have 2 fabric masks that I've purchased for myself that I switch out on a daily basis when I'm not wearing them. So I'll wear one for the day if I'm not at work in a healthcare office, when I'm out and about, going grocery shopping, living my day-to-day life, and then I'll come home and at the end of the day, put that in the washing machine and switch to my next mask for the next day. And in terms of washing, hand washing with warm water and soap is definitely good, as well as washing in, air drying or washing in a hot air, drying in a hot air dryer. And it's thought right now that washing the mask in your normal washing machine with normal detergent should also be appropriate for washing.
Okay, great, thank you. And another question with face masks. Do children need to wear face masks?
So that's a very good and very important question. It is imperative that children less than 2 years of age do not wear a face covering. And that's because that children in that age group are susceptible to suffocation and decreased respiratory drive if they have something covering their face. So it is very, very important that children below 2 years of age, so your infants and your toddlers, do not have anything covering their face, period. The order also delineates that children under 12 years of age are not required to wear a face covering. That being said, if it was my children, if they were under 12 years of age and able to protect their airway, remove the mask if they became short of breath, and be able to put it on and off themselves, I would feel comfortable with them wearing it, but there's no clear guidance at that point. But the only thing that is absolutely definitive is children under 2 should not be wearing face masks.
Okay, great, thank you. And you touched on this a little bit. I'm going to ask you another question around this. Is a person wrote in saying, I work for an essential business, so I wear my mask at work, and anytime I'm at another essential business, I'm feeling like I always have a mask on, and sometimes I feel like I can't breathe and that I'm not completely oxygenating my body, and that's very concerning. Besides exercise, what are some other practices or lifestyle changes could I make to ensure that I don't suffer from other lung-related health problems or become a carbon dioxide retainer?
So that's a very good question, and I will be honest with you that I don't have a great answer. I spent the afternoon looking for some research papers to see if this has been studied, and I don't think it has yet. Now, that being said, I think your overall risk of becoming a carbon dioxide retainer or having long-term health issues is exceptionally low. The holes that are in the mask that allow the gases to pass through, especially a fabric mask, are large enough that most of the gas should be able to pass through very easily, and especially the carbon dioxide, which diffuses in air very quickly, should be able to pass through quickly enough that it shouldn't cause any long-term health effects. Now, if you're wearing a traditional fabric mask, a bandana, or even a surgical mask, the holes as well as the space around the sides of the mask should be large enough. This shouldn't be too much of a problem. If you're wearing a more specific N95 mask, it certainly makes the feel tighter and much more suffocating. I identify with and totally feel how you feel because that's how I feel when I'm at work. That being said, I still, at this time, think the risk is low enough that it is well worth wearing the face covering and a very low risk of lung damage. On that note, if you are wearing an N95, which is not recommended, or any type of tight-fitting mask, if you have a mask that has an exhalation port or some type of device that allows the air that you breathe out to pass through the mask easier without passing through the fabric of the mask, that is not an adequate face covering, because the goal is to keep the virus from spreading outside around you if you currently have it. So we want to make sure that all of the breath that you breathe out is being filtered through the mask and not through an exhalation port.
Okay, great, thank you. Mike, I'm going to turn this question to you. Would this new requirement to wear face masks in public places enable us to reopen our businesses very soon?
Well, I'm going to answer that, but then Leslie, I'm watching again city info at ssf.net. There's like 4 questions on masks, so I'm going to jump into those after this one. As far as reopening your business, it's not the mask that is the determiner. It is the curve. It is the daily number of people diagnosed with the coronavirus, and that curve has been flattening. That's encouraging, meaning fewer people are getting the coronavirus, and on a daily basis that's being reported. So we're believing that once that gets to a manageable level, that businesses will be allowed to reopen. My personal guess, and take it for what it's worth, is about May the 15th. Between May the 15th, May the 30th, there'll be a change in the shelter-in-place order, which will allow some of society to reopen, but not others. On the city side, for example, we're wondering, when can we reopen the swimming pool? When is that safe to do? When can we start holding Zumba classes or ballet again and having groups of people in a room doing that activity? But as far as going back to work, we're relying on the health officials to tell us what is the right time to do that. But I am certain that when that time comes, you will be required to wear a mask, that you'll be wearing a mask, even though you're back at work. And I'm not sure when that will end, because as was stated, there are people who don't know they're sick out and about in the public. So if they're wearing a mask, it would protect others from getting sick. So a few other mask questions. This is from Annie, thank you. Can you clarify if I need to wear a mask when I walk my dog and exercise in the park? And it is recommended but not required that you wear a mask when you are out exercising, walking your dog, but you must maintain social distancing. So as long as you stay at least 6 feet away from others, if you're outside walking your dog, running, that sort of thing, you do not need to wear a mask if you find that uncomfortable. Let's see, another mask question. With regard to face coverings, do N95 masks prevent the wearer from contracting COVID-19? I understand the N95 is far more effective, but maybe Dr. Sloan, can you tell us what is so special about an N95 mask?
Absolutely. So the short answer to the question is yes, under certain circumstances it would. Now, those certain circumstances are if there is a high amount of aerosolized virus that is present in immediate proximity to where you are standing. So if somebody coughs, sneezes, or if you're doing a procedure on somebody and you're essentially right in their immediate proximity, yes, it would. Now, that being said, the N95 mask is much more challenging to wear appropriately. It has to be fit tested to make sure that it actually works appropriately, and it has to be very specific to your face. So different people fit different N95s, and the hospitals and healthcare systems have to go through an entire process to find what N95 works best for what person. Additionally, the N95s, while they are better at reducing the amount of virus that you might inhale, pose a potential increased risk being worn outside of a healthcare situation, because they are more difficult to take on and off, and because they are more difficult to clean, people tend to reuse them and touch the outside, and they might touch the outside of that mask that they've been reusing and then touch their eyes, touch their nose, not wash their hands immediately. It's been found and well studied that people who are wearing an N95 touch and adjust the mask more throughout the day. So unless you're in a healthcare setting where you can get a new mask daily or have appropriate decontamination of the mask, the N95 masks for the general public may increase your risk of infection if they're not worn entirely properly.
Great, thank you for that. I will point out all of our police officers, firefighters, and EMS personnel have N95 masks that have been fitted to them, and they're trained to use those, but they don't use them regularly. They use a cloth mask regularly, but if they're in a situation where they feel they may be exposed, they'll put on the N95 mask. For example, if they're responding to a call and the person appears to be sick or tells them they're sick, then they'll put on the N95 mask. So thank you for that. A few other quick questions from the email. Someone's been a resident, this is Laura, for 42 years, thank you, that have a business. They will apply on Monday for the San Mateo County Strong grant program. But if they don't get that, how are we going to help them not lose their business? Well, I'll tell you, we don't want you to lose your business, and there are layers of help, but I'll admit none of them are particularly easy. There's a lot of frustration. So for San Mateo County Strong, of course, opens on Monday. Do apply for that. By the end of next week, we should have the city program online. That was approved by the City Council last night. That will be another round of grants that will be available, and our goal is to have that up and running by the end of next week. You can apply for that also. Watch our website, ssf.net, and then the really big lifeline is coming from the federal government, which by this point has put some $2 or $3 trillion into recovery efforts. Today, they passed the fourth stimulus bill, recovery bill for coronavirus. But I understand that is frustrating as well. So do apply through the SBA for the payroll protection benefits, as well as the emergency disaster loans, and go that way. The emergency disaster loans can loan you up to $10 million. And some of that is forgivable if you keep your employees on the payroll. That's the big help. The grants from San Mateo County Strong and from the city are $10,000 or $15,000 each. Those are really lifelines to get you to the federal help, which is a lot more. So do engage on our website. We have a business recovery team that's been stood up in the city to help you get through that process, and we are here to help. Leslie, I'm kind of taking over. There's another question from the website.
Sure.
Are there return to work guidelines businesses should be observing when opening the office and transitioning employees back to work? Yes, there are. So again, you can go to our website, or you can go to the county website, San Mateo County government website. The shelter in place order has very specific guidelines and a form for essential businesses. Anyone who opens their business is required to have a written process, a written procedure to keep their employees safe, to keep the public safe, and you have to post that in public for people to see. So yes, there are guidelines. Those are available online. If you'd like more details, just email us if you can't find it on the website, and we will help there as well. And then maybe one we'll save for the end, but Dr. Sloan, there's a question. I'm tired of hearing about number of infected and deaths. Are there any news on the recoveries? I think there are far more recoveries than there are deaths, but I do agree we tend to focus on that. So maybe we'll save that one for the end to end on something positive. So Leslie, back to you.
Okay, great, thanks. And we do have some questions coming in on the chat. I am tracking them, so we'll get to yours as soon as we can. A couple questions here about, one for Dr. Sloan is just, what are the chances of contracting COVID-19 from grocery shopping? And should we be cleaning all products at home before storing?
So this is a great question, and the answers I'm going to give you are from the CDC recommendations. Most importantly, as we know right now, and I want to be very clear that just like the last virtual town hall we had, my recommendations changed in the intervening weeks. It's very possible the recommendations will change again. But so far, there have been no known cases of transmission from food or food packaging. So right now, the CDC recommendations for grocery shopping in order to keep yourself safe are to stay at least 6 feet away from others, wear a mask, don't touch your eyes, mouth, or nose, sanitize the handles of any carts or baskets that you use, and then wash your hands when you return home, and then after you put your food away. In terms of fresh fruits and vegetables, do wash them with soap and water the same way that you would have normally washed them with soap and water prior to the pandemic. So right now, the most important thing is to protect yourself in public, but in terms of how we're approaching our food and food supplies, the recommendations for now are to not make any major changes other than washing your hands after you handle them.
Okay, that's great. And this next question kind of leads into that too, is just how long does the virus live on different surfaces, especially money, like paper, coins, etc.?
So what we know about the virus so far is that it does survive on surfaces for different amounts of time based on the surface. Right now, the general thought is about 72 hours on plastic or stainless steel, about 4 hours on copper, and about 24 hours on cardboard. What we don't know is whether or not the virus that survives on those surfaces for that long remained as infectious. Because this virus is very delicate and its outer shell is very easily dried out and damaged, it doesn't do well outside of people for very long. Now, it can be infectious on these surfaces. We just don't know how infectious. We do know how long it's detectable, but we still don't know enough to give really definitive recommendations based on that so far.
Okay, thank you. This is a question that is everybody has been asking, and Mike, I'm going to turn this one to you, and that is just, do we know how many cases there are in South San Francisco?
The short answer is no, and that is because the county will not give us a breakdown by city for two reasons. One, privacy of the patient. They're trying to protect that. And two, they're trying to avoid one city or another being viewed as the center of the epidemic in the county. I will tell you, a number of cities have pushed back on that and demanded the data, but it is collected by county government. They are the health officials for the county, and they have not. I will tell you that for city staff, and we have 900 city staff, including police and fire and public works and a lot of other people. Of all of city staff, we've only had one employee, one police officer who was tested positive for COVID-19, but he is recovering extremely well, was never hospitalized, is at home, and we expect him back to work in a couple of weeks. So we've been very fortunate on city staff, but as far as our residents, no, I don't have a sense of that.
Okay, thank you. I'm going to go to some questions that we received in the chat function, and that is, and this can be for Dr. Sloan. Can you clarify that COVID-19 it is indeed the leading cause of death? The number of fatalities due to the flu is now less than the virus?
For this flu season and for year to date for 2020, that is correct. So currently, and that depends on location. Here in San Mateo County, it is not. If you look at New York City, it is the leading cause of death by far. So it certainly depends on exactly where you are and the populations that you're working with. Now, there is no doubt that COVID-19 is much more serious and much more fatal than the flu, and we have exceeded the amount of flu deaths with COVID in certain areas. But again, it all depends on how well we've done at flattening the curve and what we've done in terms of our individual burden of disease in our locations.
Okay, great, thank you. And then another question is just how accurate are the tests? I'm not sure if you'll be able to answer that.
So the tests have varying accuracy based off of what they are. The PCR tests, which are the nasal swabs, are very accurate at detecting the presence of the virus itself. The antibody tests, which is done using blood, can be somewhat variable. Now, when they're negative, they're pretty darn good at saying that the patient does not have antibodies for the virus. When they're positive, it may or may not have as good performance. And that's more a factor of all tests being imperfect and the amount of patients who have the problem via statistics does impact the performance of the test. So we have good tests, we just don't necessarily know how much we can rely on them just yet. But a positive nasal swab does indicate virus.
Okay,
and
great,
then
thank
does
you.
indicate infection.
Okay, thanks. I've got a couple of questions here. And then I do want to just remind people, if you do have a question, feel free to fill it out in the chat, or you can send a question to cityinfo@ssf.net. As you can see, we are monitoring those. But Mike, I've got a three-part question here, and they're all different questions. But the first one, and I'm not sure if you even know this answer, but when will the DMV reopen?
I don't know. But I do know that they have suspended the process of saying your driver's license is out of date. So if your driver's license, for example, has expired or is about to expire, do not worry. You will not get in trouble for that. And one day they will reopen. That's one we should push to our state assembly member, Kevin Mullen. He'll be helping us tomorrow at the food distribution. I'll ask him, and maybe we can push that out onto our website.
Okay, great. Another question is, are there any limitations in hiking and exercising?
Well, it depends. All county parks are closed. For hikings, the trails, everything on a county park is closed. City parks in South San Francisco are not closed. What are closed are basketball courts, the children's play areas, the tennis courts, the bocce courts, those are closed. But the open spaces in South San Francisco, and for example, Sign Hill, those trails are still open, but we ask that you maintain the appropriate social distancing when you do so. But you have that opportunity to get out, get some fresh air and exercise as long as you stay 6 feet away from others.
Okay, and then the third part of this question is, when will we have access to ESL in the library?
Great question. The library and Park and Rec both have done, I think, a really credible job of pushing resources online. So if you have a computer and you have access, you can go to our library department, you can go to our Park and Rec department. There's a virtual recreation area, for example. You can take virtual tours of art galleries around the country. We've done story time online for children. So we're putting a lot of those resources online. And for the moment, that's what it is. If you don't have a library card, you can get one immediately online and then check out ebooks and online videos through our library system. But we are waiting for the county health officer to tell us when we can actually do in-person reopen the library and provide those functions. I hope, again, by the end of May or somewhere around there, we'll be able to provide those services to our community. Know that when we do, we have already done an extraordinary job of cleaning all of our facilities in preparation for opening. Our staff is anxious to get back to serving the public, and we will do so in a safe manner as soon as the county health officer lets us.
Great, and this might be Mike or even Dr. Sloan, a question that has come through. It says, the testing data that is being gathered by the city, county, or state level, can we be sure it is being used only for this COVID-19 virus situation?
I can go ahead and answer that. And so far, the tests that we're doing, the only information that we would be able to get from them is COVID-19. There's no data that would be collected outside of the COVID-19 infection. Now, if you're hospitalized, they gather other data about what's going on with you, other medical problems, your course of care, your health, all of those things that are pertinent to your medical care. But any testing that's done outside of the hospital for the purposes of COVID-19 is solely for the purposes of COVID-19.
Okay, perfect. Thank you. A question that came in through email is this is correct, that we did say that it's not required for people who jog. Wearing a face mask is not required for people who jog and walk their dogs to wear masks, which they believe contradicts the countywide rule. If we could explain a little bit more about this shelter-in-place order and what does apply. Mike, I'll turn that to you.
Sure. The order is pretty clear that it is recommended, but not required. If you are outside walking or jogging or doing health-related exercises, you are not required to wear a mask, but they encourage you to do so. You are required to maintain social distancing. So the actual language of that order is available on the county website, which is smcgov.org. But the health officers made an exception for those who are jogging. You might imagine how you're breathing when you do that, or out walking briskly, and felt as long as you maintain social distancing outside, that would be an acceptable exception.
Okay, great. Thanks for the clarification. Another one that just came through chat is it safe to wear N95 masks that you already have at home when running essential errands, such as grocery stores, or should we wear a different mask? How do you sanitize N95 masks? Do you wash with soap and water? I'll put that to Dr. Sloan.
So the overall answer to your question is yes, it is safe to wear the N95 mask that you already own. If you own N95 masks that have an exhalation port, I would not recommend wearing those because that defeats the purpose of the face covering order for protecting the people around you. In terms of sanitizing the masks, you should not wash an N95 mask with soap and water. The process for decontaminating an N95 mask is actually fairly complicated and requires advanced technology and advanced equipment using things like vaporized hydrogen peroxide, and is still in the relatively early stages of being able to use it on a mass level. In terms of sanitizing and cleaning an N95, I will tell you what I do personally for my N95, but currently there's no formal recommendations on it. Because the virus is so delicate, I cycle through my N95s. If I don't need extra N95s for work, but I like to conserve the ones that I do have just in case. I will dry them out in a paper bag and take a break from using an N95 after a full day has elapsed of use, where it sits in an N95 bag and is able to dry out for at least a week. Now, with that being said, there was recently a study that showed that viral particles were detectable on the outside of masks 7 days after their last use. So that might not even be enough to make sure that those masks are free of virus. So jury's still out, and hopefully we will develop a way to get them clean at home. But because of the way they're designed, cleaning them in soap and water would render them ineffective.
Okay, great. Thank you. And I did receive a question via text. And again, if anybody has a question, feel free to text at 650-636-6668. This is one that I'll pass off to Mike here, and that is, what can South San Francisco residents do to help during the COVID-19 crisis?
Well, I love that question. Well, the first thing is, please abide by the shelter-in-place orders and take care of yourself, your family, your neighbors. Stay at home. If you must go out, wear a mask, maintain social distancing, wash your hands, all those precautions that the doctor spoke about just a moment ago. You can also volunteer if you are so inclined for our community volunteer corps. probably a month ago now, we stood up a community volunteer corps of civic-minded individuals willing to help those in need. We have seen a really dramatic rise in the human need side of this. People have lost their jobs, they're burning through their savings, they need food. We have seniors who are not comfortable going to the grocery store. We have those that are sick and presumably quarantined at home who need help. So we do have a community volunteer corps. Again, you can go to our website and sign up. And if you'll feel comfortable helping us deliver meals to seniors, we're doing that every day of the week. And again, tomorrow we have a very large food distribution at Hillside School, right off of Sister Cities Boulevard. And we have a lot of volunteers there to help bring people in and deliver food there. So there are plenty of volunteer opportunities. So number one, take care of yourself, take care of your neighbors. And number two, if you're inclined and have that ability, please volunteer. There are plenty of places where we will need your help.
Okay, thank you. I've got just a couple more questions and then we'll look at wrapping this up because I know it's getting a little late, but we'll address a couple more questions. And that this one is, what is the phone number to report about non-compliance on COVID-19?
I'm hoping Jeff, as a party, our police chief is still on. He can unmute. Jeff, what is that phone number you'd like them to call?
Can you hear me?
Yes.
Okay, so the phone number, the best phone number to call, unless it's an emergency. An emergency is always 911. But the best phone number to use for reporting a public order violation would be obviously 650-877-8900. So 877-8900, and that'll get to our front office and where we can transfer it into dispatch if we need to, or we can take the call straight at the front office. If you call 911, it just goes right to a dispatcher, and it makes it harder for us to triage that because that call, every 911 call obviously has to be answered as soon as possible. And I just also wanted to add, because you brought up Mike earlier, the police officer that we have that was COVID positive is actually feeling great and was clear today, and he's coming back to work on Monday.
Awesome. Thank you, Jeff.
Okay, great. And we've got about 3 more questions, and then we'll wrap it up here. But Mike, this one's for you. Is there an updated list of businesses allowed to open in the coming week? And is hair salon essential?
Well, if those of you who know me know I have no hair, so I would say no, it's not essential. But beyond that, no, hair has been ruled not essential, as has manicures and pedicures. That's why nationwide there's a great increase in the number of home hair dye sales, and nail polish sales have gone way up because those are non-essential businesses. What was the first part of the question, Leslie? I'm sorry.
Let's see here. Updated list of businesses that will be allowed to open in the coming week.
Well, we do have a list of businesses that are currently open, and that's available again on our website as well as the South San Francisco Chamber of Commerce website. And I encourage everyone here, please buy something from those businesses. Help them stay in business. Many of our restaurants are doing takeout or delivery, or you can buy a gift card from one of our businesses for use later in the year, or buy a gift card and give it to our police chief or other first responder as a thank you, but help our businesses stay in business. And those are available on our website as well as the South San Francisco Chamber website. And we keep that list up to date. As far as what businesses will be open in the future, we don't yet know because it is dictated by the county health officer. And hopefully in mid to late May, we'll get a revised shelter-in-place order, which will give us some guidance on which businesses may reopen as long as they exercise the appropriate health protocols. So more to follow there. Check out that website though, ssf.net.
Okay, I've got two more questions and then we'll wrap it up. The one question is, we'll put this to Dr. Sloan, and that is, it has been on the news that the African American community is being affected hard by COVID-19 virus. And can you explain why this is the case?
Yeah, that is very true. Communities of color in general, not just the African American community, do seem to have a significant increased risk of bad outcomes with COVID-19. And while the reasons are still being investigated and are still unclear, we see it most in areas with the most income inequality and socioeconomic inequality, which may be a factor. People who have less access to healthcare may have more chronic underlying conditions, which might make them more at risk for COVID-19.
Okay, perfect, thank you. And then one more question, and Mike, I'm going to turn this one to you, and that is, how is the homeless population being handled, specifically bathrooms, for example, in downtown?
Great question. First, many of the homeless in California have now been housed. The state of California has rented entire hotels, including some hotels in San Mateo County, none in our city, but nearby, for the homeless to shelter during this time. So as we go out on a daily basis and police go out, we're actually seeing fewer homeless on the streets of South San Francisco as a result. As far as bathrooms in the downtown, I think that would be a challenge for anyone, homeless or not, given that the closed for that sort of thing, and there is nothing that is being provided. But we do have our downtown bike patrol every day in the downtown on their bicycles, walking the streets. And to date, that has not been reported as a problem. But let me get with the police chief and see if that is an issue. I'm not sure what the answer would be. But the bigger picture is a real effort has been made to find temporary shelter for the homeless in California. And by and large, that is working.
Okay, and I did want to go back to that one question that we said we would get at the end, and that was kind of the good news story of the person said, you know, I'm tired of hearing about the number of infections and deaths. Any news on recoveries, and what are those numbers? And so I thought I'd turn that back over to Dr. Sloan.
Yes, and I am very, very happy to put a good news spin on all of this information. The vast majority, the absolute overwhelming majority of people who get infected with COVID-19 will recover after a mild course of illness. Even the vast majority of people who require hospitalization will recover. Now, right now, as we're still trying to find out the exact burden of the disease, I can't tell you the specific number. But from what we do understand so far, at least 4 out of 5 people who get sick with COVID-19 will go on to recover and do well. And in fact, I've met dozens of them in my own work, and even had several of my own colleagues who've contracted COVID-19 throughout the country while at work, all of whom have recovered and done great. On top of that, going down a more good news pathway, the amount of scientific discovery and the amount of collaboration and teamwork we've seen, not only from universities and researchers, but from private industries and businesses, is unprecedented. We are working with the entire force of the whole world behind us to not only find a cure and not only to contain this, but we're going to come out of this not only stronger and better than we were before, but with so much more scientific understanding about how to prevent this in the future. We will come out of this okay. We will survive, and I am confident that we will get through this.
All right, that's a great way to end it. And before I turn it over back to our city manager, I just wanted to remind people that this town hall recording will be posted on our website, as well as the questions that we received along with the answers that will be put on our website. If you haven't gotten it, we've said it quite a few times tonight, but it's www.ssf.net. And you'll see the coronavirus landing page there, and that's where you can get all of our resources. I do want to encourage you folks to sign up for our city email updates. We give updates from our mayor on a weekly basis, and any information we receive, we have an email distribution list. And if you just send a note to cityinfo@ssf.net, we'll get you on that list. And I know that our city manager will be happy for me promoting this, but I did want to remind people to not forget to do the census. And with that, I know that he has a few parting words to say on behalf of him and the mayor. Mike?
Yes, thank you, Leslie, and thank you, Dr. Sloan. So for those on the call, please, it is an anxious time, but rest assured that Mayor Rich Garbarino and the entire city council and your entire city staff is focused on making sure that you are safe, your family is safe, and then as a community, we recover from this particular pandemic. Recovery means in the short term, making sure that your family has food, that we're helping our businesses survive, that if you've lost your job, we can help you apply for unemployment, we can help you look for another job, but we are your partner in surviving this and then thriving on the other side. South San Francisco is an extraordinarily strong city. It's industrial base, it's business base, and the resiliency of our residents has been proven before, and it is being proven again, and we will come through this on the other side. There are many questions, and every day we find new answers, whether they're medical or otherwise. So again, check that website. We update it every single day. It's the main portal for information, and then we do our best to push information out to those that don't have a computer and don't have access to that. So thank you for tuning in. I encourage you to continue emailing us questions, and we will answer those because we are here to serve you. And have faith, we will get through this together.
Great. Thank you, Mike, and thank you all for joining us this evening. Have a good night.